Hello, I am Fred Lublin, Saunders Family Professor of Neurology and Director of the Corinne Goldsmith Dickinson Center for Multiple Sclerosis at the Icahn School of Medicine at Mount Sinai in New York. We're going to discuss management of patients with multiple sclerosis. I'm joined by my colleague, Dr. Bruce Cohen, Professor in the Davey Department of Neurology and Clinical Neurosciences at Northwestern University's Feinberg School of Medicine in Chicago, Illinois, and Dr. Andrew Goodman, Professor of Neurology and Director of the Multiple Sclerosis Center and Chief of the Neuroimmunology Unit in the Department of Neurology at the University of Rochester Medical Center in Rochester, New York. Gentlemen, welcome. We're going to discuss case management here, which we've been doing. The case I'd like to mention is of a woman who, at the age of 28, developed optic neuritis. An MRI scan had one lesion. Her doctor chose to follow her over time. 2 years later, she had a partial myelitis, numbness and tingling rising up to the rib cage, a little bit of walking difficulty. The MRI showed about 5 new lesions, 2 of which enhanced. And her doctor put her on interferon beta 1A, 44 micrograms 3 times weekly, and followed her. And she did well for about 2 years. After about 2 years, she had an episode of double vision, along with some numbness in the face. And her physician ordered an MRI scan, and it showed 3 new lesions, new T2 lesions from the scan she had had 2 years before. He checked her for neutralizing antibodies to interferon. She didn't have any. He said, that's fine. Let's just see what happens. Goes along, 6 months later, she has another episode of diplopia, and this time with facial weakness on the opposite side. Does an MRI scan. There's 3 gadolinium-enhancing lesions, one of which is in the right side of the brain stem. What do you do? Andy, start with you.
Well, clearly there's concern that her treatment is suboptimal. It doesn't mean it's not doing anything, not working, because it's not being neutralized by the immune system. But nonetheless, without full understanding of the biology of interferon and of MS, we do recognize that for some people, interferon may be suboptimal. And in such a case, I would strongly consider switching to a different medication.